The concept of aesthetic dentistry and selecting has everything to do with what treatment recommendations are made for the patient. The important factor of this, though, is to step back and look at the patient comprehensively. Aesthetics can be something as simple as one tooth, but typically requires you to decide if one tooth is all that's necessary. You have to look at all of the other teeth to decide that the one tooth is appropriate to focus on. Therefore, there has to be a system involved in looking at the facial parameters of the patient, what the smile characteristics are, and what the individual requirements of the teeth and gum tissue are to decide what aesthetic restoration needs to be done.
So Leonardo da Vinci, centuries ago, tied form to function, that form and function go hand in hand. Teeth are shaped the way they are and positioned the way they are ideally because that's the way they work the best. So taking aesthetic considerations into mind when you're planning a case, even if it's just because the patient has functional problems, the aesthetic considerations are still very important in getting a final result that not only lasts a long time, but looks good.
In our view, that's the difference between cosmetic and aesthetic. Aesthetic involves marrying form and function that has a beautiful result that will last a long time.